Good evening, fellow South Africans and citizens of the world. Well, I've talked about the National Health Insurance Scheme and how it's just too expensive for South Africa to implement. And the only way they're going to do that is by raiding the pension funds, which is largely white pensioners' money. And of course, that'll then be used to finance the what's left of the health system in South Africa. And that's really the issue we're talking about here, because there's a huge brain drain happening in South Africa right now, and a large percentage of that are people in the health industry. Experts have warned that the incoming National Health Insurance, or NHI, may be dead on arrival as a large number of doctors plan to leave South Africa or have already left. The incoming NHI will rely on a large network of doctors to service patients around the country, with governments promising universal health coverage. Well, of course, I guess in place of doctors, they can use the old traditional sangoma, can't they? In fact, they might actually have to do that. I wonder how that's going to work. Anyway, carrying on. The bill has renewed fears that mass emigration of doctors and other health professionals which would kill any health plan that relies explicitly on there being more doctors. Now, just on that particular point, I've got to mention to you that there is a huge shortage in Australia of carers, people who are professional carers, who've got the qualifications. If you can care for the elderly, the sick, look, I'm not going to say you just walk into Australia, but I would suggest that if you're thinking of your options, you Google Australia, make some inquiries, and see if you can get yourself across here, because there is a huge shortage of people in that area. Speaking to the paper, Dr. Chris Archer, CEO of the South African Private Practitioners Forum, said that his members are extremely concerned and that the bill may drive emigration, as those who want to leave see it as the reason to do so. ProfMed Medical Aid CEO Craig Comrie said that health professionals are already emigrating. Comrie said ProfMed's members are mainly health professionals, of whom 17% leave each year. This rose to 30% in June and July. Alex van der Heever, Wits School of Governance professor, added that he expects medical professionals to emigrate in their hundreds, joining their countrymen in countries like Dubai and Australia. These concerns align with the research published by Solidarity, which has previously warned that the introduction of the NHI could lead to a mass exodus of doctors from the country. One of the most worrying findings in the survey was that 83.2% of healthcare workers believe that private health professionals will leave the country if the NHI is implemented. 43% of the respondents said that they themselves would consider emigrating. There was also a firm belief that the scheme would completely destabilize the country's healthcare as a result. The major points of concern are shortage of specialists, doctors, nursing staff and other healthcare workers, financial management of the NHI, purchasing and distribution of medicines and equipment, and maintenance of infrastructure and equipment. Now, you can say the same about anything in South Africa. But of course, the big one is the financial management, the corruption that just is associated with anything that this ANC government does. All right, guys, please remember to subscribe to be kept informed. Ring the bell for the updates. Please click the like box and have a safe evening.